Hey, Artist Talk family. Thanks for tuning in. Today we're here to interview all the panelists for Black Therapy 101. That's happening on November 22nd from 3 to 6 p.m. at Air Gallery on the North Side. Super excited to introduce you to all of these amazing therapists, sound bowl healers, psychotherapists, social workers, and beyond. All right, here we go. Thank you so much for coming, Miss Sharise Nance.
Thanks for having me.
Yes, I attended your S.W.A.G Awards last year. I see you just constantly showing up in community for social workers, for therapists, for Black entrepreneurs. Just, you create so much space for so many people that just really deserve it, and you make sure they're seen and heard. So it feels good to be here, and
Thank you.
I'm excited to see and listen to you, and for people to get familiar with you and your work.
Thank you. I appreciate that.
And for you to be a panelist on Black Therapy 101.
I'm looking forward.
So I'm just gonna dive in with some questions for you. So you are a compassion fatigue expert. And you've done a lot of speaking and workshops around that topic. How do you define compassion fatigue for somebody that's not familiar with that term or with what that looks like?
Yeah. So compassion fatigue is often misunderstood. It is beyond just being too tired or stressed. It's the mental and physical exhaustion that causes a pronounced change on one's ability to have empathy for the people they serve, their colleagues, their loved ones. It's often referred to as the cost of caring without enough space to recharge or recover. I refer to it as the common cold of helping professionals.
Yeah.
Because if you do this work, you are prone to catching that cold.
Yeah.
It's about building an immunity to protect yourself against that cold.
Yeah. What are helping professionals? Like, who falls under that?
Good question. Mental health therapists, social workers, nurses, doctors, medical professionals, educators, frontline workers, first responders, even attorneys, funeral directors, anyone who is providing care to people and sitting with and absorbing their pain and their trauma.
Yeah, and taking on like a community's worth of everybody else's pain and trauma,
and caregivers too.
Yeah,
for people who are caregivers of their loved ones.
Yeah,
you're sitting there with them. You're bear witnessing their pain and their suffering and their trauma.
Yeah, I do see that a lot, even in just my personal life. My mom's a hospice nurse, so bless her heart. I have no idea how she does it. But there was a period in my life where I feel like my mental just wasn't where I wanted it to be, and I was isolating a lot. She's like, you should come and volunteer at the hospice center that I work at. And it really just like changed my life, but really me in that period, just being in that space and, being a servant, but also just being able to contribute like in happiness and positivity to people's lives. But I think also what I wasn't prepared for was being in those spaces and seeing the lack of compassion and care, seeing nurses come in and out of the space and just kind of like writing something on a chalkboard or whiteboard and not really engaging with people and just kind of doing their job and kind of that muteness and that lack of. Yeah. So I've seen that in my personal life, and I didn't know what the term was, and I didn't know what it looks like. How do you know if you're going through that as a professional that's in one of those fields, or just, in regular life? What are the signs of that?
Yeah. So I heard you mention something that speaks to the desensitization that comes from it. When we're speaking of compassion fatigue, it's a feeling of depletion.
Mm.
The well is empty.
Yeah.
You have nothing left to give. And many of us become plagued with compassion fatigue or even burnout because we are serving from empty cups and empty wells, and we've been doing it for too long because we wear it as a badge of honor. We just push through, we keep going because that's what we were taught to do. So when you are seeing people or you notice it in yourself, you're becoming more irritated, overwhelmed by tasks that typically wouldn't overwhelm you. You found joy in doing them, or you even begin to lose hope. You begin to question care. You begin to wonder if this work is for you, or do people really get better? Why am I doing this?
Yeah. I can relate to that. I think with Artist Talk, there was this constant cycle of me doing the work and like hitting the ground running, and then like me burning out and feeling like just like an emptiness kind of in a sense, or like questioning like, am I making an impact? Is this working? And then like me getting some rest and then hitting the ground running again and then doing it all over again. And it really took until me meeting Dr. Darla and like having some of these conversations and being vulnerable for her to identify like, oh, you're burning out.
Yes.
So burnout is prevalent in high demand fields.
Yes.
What signs do professionals see that maybe aren't like caretakers, but just like entrepreneurs and professionals? What type of signs do they see? What does that look like?
So I think it's important to differentiate between compassion fatigue and burnout because there's a lot of overlap when it comes to those two terms. I refer to them as first cousins because they're two sides of the same coin. With compassion fatigue, it's the exhaustion and depletion from empathizing with people who are in pain and suffering. With burnout, it's more of the exhaustion from work-life demands. When the demands of your work and your life exceed your resources, your ability to cope. It's that prolonged exposure to chronic stress, and you just don't know what to do with it. It's a slow burn, almost like if you've ever experienced an abscess on your tooth. It doesn't start off really painful. You just keep going. You keep pushing through until that pain is so excruciating that you are banging down the dentist's door. You need to get seen. That's what happens with burnout. It's a slow burn. It happens over time. And with compassion fatigue, it's something that can happen. It's like episodic. It can happen just from seeing a patient, seeing a client, sitting with someone in their pain and suffering, if we are not intentional with our recovery.
Yeah. So I'm sure you've seen, tons of that and experienced it because you do social work.
Yes.
Is where you started?
Yes.
Okay.
Yes.
And now you do one-on-ones, you work with organizations. You just did that workshop I saw on Instagram with the Pittsburgh Foundations and bigger organizations, and you influence systems and policy conversations. Tell us a little bit about like what that work looks like and what that progression has looked like from, you like supervising now to what it looked like at the beginning.
Yeah. So in the beginning, I never thought I would be a therapist. I was not interested in that. I knew I wanted to help in some capacity. I was a shy kid. I didn't speak up for myself. But once I got the courage to do that, I realized how important it is for us to advocate for ourselves and to support people who can't find their voice, to help them learn to advocate for themselves. So I took it upon myself to figure out a role in which I could do that. And I found myself in social work because it's so vague and it's so broad that I can do anything with it. And then I found myself in mental health. My business partner at HandinHand Counseling, Tess, she's a professional counselor, and she's like, you should try it. You might actually like it. And she was right. And I did. And I began to love it. And what they don't teach us in school, when I was in school, which was a few decades ago, was very traditional. So you felt like you're kind of in a box, that you have to do it one way, the traditional way. You go to school, you get an education, you're going to be in the community helping people. But it wasn't until, I graduated, I started working. And then when I opened my business and now I have to go and be around other business owners, I'm like, oh, so I can leverage my skills beyond the therapy room, beyond just being a social worker. And I can get as creative as I want to. I can write books. I can facilitate workshops. I can supervise other therapists. And I started to love that more than just being in the therapy room. It allowed me to have more impact and to help more people.
Yeah. Because you're relating with it. You're like, I see what the effects of it are, and there is no one way to really do it. And I feel like it's really dope that you started in social work, because a lot of the social work is so foundational to therapy.
Yes, it is.
If you don't have somewhere to live, or you don't know where to get food, I couldn't imagine, sitting in a room with a Dr. Darla or with you trying to talk about what's going on in life, and my stomach is growling.
Exactly.
And I'm thinking about where I'm going to sleep tonight. So, I always admire people that start from the building blocks of something so they can understand all the elements of it. I think that that's so important in any career field.
Absolutely.
So that you can relate on a level. Like in my mind, I'm always like, I want to be a student and a teacher. So we run our cohort through Artist Talk Mental Health with Dr. Darla, therapeutic spaces, but I also actively participate in cohorts and apply to cohorts. And I think it's really important for us to be able to relate to what that person on the other side of the table is going through, or learning, or thinking, so that we can have a conversation and a dialogue.
That reminds me of Maslow's hierarchy of needs. At the very bottom is our basic needs. And many times we're trying to meet people at the top, self-actualization, where we're talking about professional development and these big goals that we have, but they might not be there. They might still be at the very basic level where they're just trying to figure out what their next meal is, or how they're going to pay their bills.
Yeah. It reminds me of a saying my friends always say. They're like, I'm gonna just get it how I live. And if that's how you live in, that's the level that they can kind of meet you at. So kudos to you for, just going through that process. And I feel like you and I, we talked about before the interview on the phone, when I was just asking you to be a part of Black Therapy 101, the trust with therapists and their patients. And I mean, that just adds an element for me where it would make me more trusting, because you understand and you get it, not just one aspect, but all of them and everything that encompasses it. So what is the most rewarding part of all of your journey and being in all of these spaces? Right now in this moment, what feels most impactful, and you're just walking in your purpose?
There are so many things. I can't name just one. The first thing that comes to mind is watching the development of other therapists and social workers. Just seeing them become more confident in their role, just watching them just grow into their own and find their own voice and feel comfortable in how they are navigating systems, how they're helping their clients navigate systems, and just being grateful that I got to be a part of that journey.
Because you supervise them.
Yes, whether my name is mentioned or not, but just knowing wow, it's an honor and a privilege to watch them flourish. And also, just sometimes we need to say that we're proud of ourselves for trusting ourselves and just allowing God to use me with this platform. It's a large platform, and I don't take it for granted. And I'm grateful that I took a leap and stepped out on faith, leaving my full-time job and opening a practice with my partner and public speaking, getting up in front of hundreds of people.
Public
And
speaking is scary.
it can be. But what helps me most is knowing that it's not about me. I'm there to serve, and I have something valuable that I know is going to help them, and it's going to impact beyond them. It's going to impact their families. It's going to impact their clients.
Yeah. Well, I'm so excited to just introduce you to the Artist Talk community. I feel like one of the things they talked about in the last Black Therapy 101, when we were asking them, like, what do you want to see more of? Or like, what do you want to see at the next one? They were like, well, we want to be introduced to like other avenues, like what therapy could look like in other spaces, whether it be, a compassion fatigue workshop, or understanding what burnout is in certain rooms and really communities. So I'm excited to have you join our community. Your dedication to mental health is definitely exemplified. And your presence at events like Black Therapy 101 is definitely needed. What are some of the things that you hope to share and achieve at Black Therapy 101? Like, what are some takeaways that you want people to walk away with after getting to know you better?
So one of the main things when I'm talking about compassion fatigue and burnout, I just want people to be able to build a foundation of self-compassion and self-awareness. That's where it starts.
Yeah.
We have to have, in order to change something, we have to be able to name it. So just having an awareness of what it is that is impacting us.
Yes.
And then understanding, most importantly, because this happens in therapy all the time, we are not going to change these things overnight. We're not here to fix you, but just understanding you did not get here overnight. So we're not going to rewire or recondition or change years, if not decades, of how you've been responding to something, how you've been doing things. And that's where the self-compassion is. You got to give yourself grace and have some patience.
I was just literally, as you were speaking, that is the word that was like echoing in my mind, was just like grace and time.
Yes. People want things fixed yesterday.
I mean, that's the society and the culture, the pressure that it puts on. And it's like, be better, do this. And like, there's so much instant gratification.
Oh my goodness.
So yeah, I appreciate you just, just showing and speaking about the reality of the situation, and that, yeah, it takes time and grace sometimes. And I'm excited to just continue this conversation at Black Therapy 101. And I'm excited for the community to ask you questions and to dive deeper into all of your expertise.
Same.
And we're excited to have you as a guest. And just thank you for being here today and for sharing. I'm excited for people to watch and get to know you better, and to come and meet you in person at Black
Thanks
Therapy
for having
101.
me. Appreciate
Absolutely.
it.
Thank you so much.